911, what's your emergency?
I'm at milepost 29 on the W&OD trail. A woman has fallen. There's blood pouring out of her head.
It was April 14th. I got a phone call at 11:20 in the morning from an unknown number, and I just answered it by accident, really. And it was a woman that said, "I'm biking on the WAD, and we found your wife. We've called 911, and emergency services are all the way." We got in the car, and I just started driving. The EMS captain came on the line, and I just said, "We've got to get her to Inova." And she said, "Sir, I don't know if we have time for that." After they did the assessment, they said, "We're taking her to Inova Fairfax." And it was a deep sigh of relief.
I've known Dr. West for a very long time. In trauma, it's variable and unpredictable, especially when it's your mentor, and on top of that, your good friend. It makes it especially more personal, obviously. At the end of the day, it is an injury, and it meets certain criteria for operative intervention, and you address it that way, just like any other patient.
We were all very alarmed to hear about what had happened. Fracturing your acetabulum is probably one of the largest injuries we take care of as orthopedic trauma surgeons.
On the day of Robin's surgery, it was a long surgery, extremely stressful. And as you're sitting there waiting, every thought goes through your mind.
It was about a 10-hour surgery, I think, that day, and that's long for two surgeons working. It gives you an idea how extensive the injury was. But at the end, we were quite happy with the result.
When Dr. Holtzman and Dr. Malagzeta walked through those doors, they told me it would be a long road to recovery. Not just the trauma team, but rehab services, and also the mental process of getting back. These are all things that we're happy to go through as a family and go through as part of the Inova family.
I can say that when I was first looking at Inova as the place where I was going to finish my career, Dr. West was one of those examples where I knew that someone who would deliver that level of excellence, I could count on. It's inspiring to see that team then rally around taking care of one of their own to take care of Dr. West. I can only imagine how proud they all were to know that she trusted them with her own care, and she's been proven well served by that.
The easiest part of this was getting to Inova and turning over the care to them.
I was very at peace when I look back at my time in the hospital. And I remember the anesthesiologist talking to me, my surgeon talking to me, Dr. Malagzeta, and kind of holding my head and saying, "Robin, this is a really bad injury, but I'm going to do everything I can to keep you alive." It was very heartwarming to feel that and to feel, everyone's love, and they had provided this for me. It's hard when you're hurting and recovering to be 100% of the wife, the mother, and the physician, and then also worried about getting back to operating and seeing patients, and so I decided to take baby steps. And coming back to the operating room and back to seeing patients in the office really gives me hope that I can continue to do what I love doing. I'm really forever indebted to everybody who touched me one way or another. The first responder who found me, the emergency room, my friends, my family, all the incredible support. I'm forever grateful.